Hey, pals, you glance in the mirror and see indications of age on your face, in your graying hair, and maybe even in the way your joints creak a little louder in the morning. But have you ever thought about how your penis, which is an important aspect of being a man, is also getting older? Your penis becomes older, much like your heart beats slower, your brain forgets a name, or your bones get weaker. And what if you don't pay attention to it? That doesn't only make it less able to accomplish what it used to do. No, it takes away something far deeper: your self esteem, your sense of worth, and the close relationships that make life so rich and fulfilling. Hi, I'm Dr. Leila. I've been a urologist for over 30 years and am very interested in men's health. I've spent my whole career assisting men, especially those over 60, not just keep their sexual health, but also get back their whole identity, the inner strength that makes us who we are beyond the numbers on a calendar. I've had patients come into my office with their shoulders sunk, feeling like they were losing the battle against time. When they left, their eyes were bright, and they were ready to live life to the fullest. What if I told you that age has nothing to do with the fundamental reason why older men have problems with their penises? That it's not something that has to happen, but is often the result of bad behaviors, and that a simple daily routine might change everything without drugs or surgery. In this chat we're having today, which I consider as a real conversation between you and me, I'm going to provide 5 important tips based on good science and made just for men like you who are over 60. These aren't crazy tactics or miraculous cures. They're real, useful ways that have helped so many guys I've treated stay healthy and improve their quality of life. And wait, because I'm going to give you a bonus tip that most of my doctor friends keep to themselves. It could help you avoid one of the most painful and debilitating ailments that older people get. Before we get started, if you haven't already, please click the subscribe button and turn on the notification bell. You won't miss any of my useful advice that is specific to your stage of life. These ideas come from the heart of an expert who has seen and addressed these problems thousands of times. If you like this video, please leave a comment below and let me know what you think, or if there's anything I could explain or look into more. Your comments aren't just words, they help me improve my videos so that they are like individualized consultations for you. Let's start at the beginning with what is probably the most misunderstood part of penis care over the years: keeping it active. We all learn the same thing in life: use it or lose it. This is a fantastic example of that. One of the most common things I hear from guys in their 60s and older is, "My sex life is over." It's normal at my age. Many of them believe that the flame will die out with the extra birthday candles and that there's nothing they can do about it. But let me tell you something important that I've learned over the years about male physiology. This idea is not only erroneous, but may become a self-fulfilling prophecy that speeds up decline. Your penis, like your biceps, heart, or even your head, needs regular exercise to stay healthy. If you don't utilize it, blood flow slows down, tissues lose their suppleness, and gradual atrophy sets in. This is what doctors call penile atrophy due to disuse. It's only biology, so don't worry. I treated a 68-year-old widower named Robert who had stopped having sex after his wife died. He thought it was over for him. When he came to see me for problems with getting hard, we talked, and he understood that not doing anything had made things worse. We brought back some simple habits, and in just a few months, not only did his function become better, but he also got his love of life back. Sexual activity, whether with a partner, through masturbation, or even light stimulation, is not solely focused on immediate gratification. It's important to keep everything in good shape, just like stretching a muscle to keep it flexible and strong. It increases blood flow, oxygenates tissues, and keeps everything in good shape. Research, like those published in the Journal of Sexual Medicine, shows that men who have sex regularly are more than 30% less likely to suffer erectile dysfunction than men who don't. What if you don't want to be in a relationship right now, or if solo stimulation makes you feel bad? Don't worry. I've told several patients to use medically approved vacuum pumps, which mimic blood flow without much effort, or Kegel exercises for the pelvic floor. These are easy contractions you can do anywhere that strengthen the muscles that sustain erections and increase circulation. You could think of it as a private gym for your private parts. The most important thing, don't allow yourself get lazy. Your body is always grateful when you use it. There is a big effect on the mind as well as the body. For many men, their sexual health is closely linked to their sense of what it means to be a man. When it goes down, confidence usually goes down too. But by staying active in ways that work for you can get back not only your performance, but also your natural pride. It's not about going back to being the 25-year-old you used to be. It's about appreciating the smart, experienced guy you are now. I've seen people in their 70s come back to life, not just sexually, but in general, more motivated and more attached to their spouses or new loves. It's a snowball effect. When your intimate health improves, your self-esteem goes up, which gives you more energy for all parts of your life. For example, my patient Henri, a 72-year-old retiree, was depressed after having his prostate removed. He not only got his erectile function back by adding modest sexual activity to his routine, but he also started going out again, laughing and feeling alive. Research from Harvard University backs this up. Guys who are sexually active have more consistent testosterone levels and are less likely to get depressed. So, start simple, like with a weekly stimulation session, and see how your body and mind wake up. Now that you know how important it is to keep things moving, let's talk about a basic pillar that a lot of people don't think about until there's a problem: good hygiene. It might sound simple, like brushing your teeth, but after 30 years of seeing guys in my clinic, I can tell you that this is one of the most neglected parts of male self-care, especially as we get older. I've seen infections that keep coming back, persistent discomfort, and even advanced instances that could have been avoided with a little more care. It's not just about being clean, it's about changing your behaviors as the world changes. Our skin gets thinner and more delicate as we get older. Our immune system slows down a bit and bacteria have an easier time getting in. At 40, things that weren't a big deal can be a big deal at 60. For men who aren't circumcised, it's even more important. Sweat, dead skin cells, and germs can build up behind the foreskin, which can cause balanitis, a painful and swelling inflammation, or worse, raise the chance of penile cancer. Yes, you heard me right. Studies around the world, like those in Brazil where rates are among the highest, show a direct correlation between poor hygiene and this risk. It doesn't go down with age. In fact, it becomes worse. Paul, 65, came to see me with severe balanitis that he had been ignoring for months. He thought it was just a sign of aging. After treatment and instruction on how to keep clean, the infection went away, and he told me he felt renewed and more confidence in his body. The answer is easy and gentle. Wash every day with warm water and a light soap that doesn't have any scents or harsh chemicals that throw off the natural pH balance. Gently pull back the foreskin, rinse it gently, and most importantly, dry it well with a clean cloth. Bacteria hate moisture. This is really important after sex. Fluids, sweat, or lubricants can throw off the skin's natural balance. This procedure only takes a minute, but it can stop bad smells, unpleasant infections, and major problems. And how does it make you feel? Huge. When you treat your penis with the same attention as your face or hands, you tell yourself, I am worth taking care of. I have seen men get their confidence back just by making this part of their daily routine. The American Urological Association's research shows that good cleanliness can cut the risk of urogenital infections in seniors by up to 50%. So, like your daily coffee, make it a habit. It's easy but will change your life. Speaking of prevention, there's a hidden risk that too few men know about during intimate moments until it's too late. To put it simply, don't have sex with a penis that isn't fully erect. This may sound like small advice, especially when you're feeling really passionate, but trust me, I've seen this happen hundreds of times in the clinic, and it's a common mistake that can lead to serious injury. Your penis isn't indestructible. Inside, it's a complicated network of muscles, arteries, and erectile tissue that needs to be completely stiff to handle pressure. While you force penetration while you're just semi-erect, it causes microlesions, which are microscopic tears that don't hurt at the time but build up as scar tissue. Over time, this can turn into Peyronie's disease, which causes the penis to bend uncomfortably, making sex hard or impossible. I remember a patient named Mark, who was 62 years old and came in with a 30-degree curvature that he hadn't seen at first. He recalls hurrying through personal sessions thinking that was normal. Unfortunately, the choices were few at that time, but if he had understood sooner. The International Journal of Impotence Research says that up to 13% of men over 60 get Peyronie's disease, which is generally caused by a lot of damage over time. The most important thing, be patient. Thing, B. Before moving ahead, make sure you have a strong erection. Use lubricants that are water-based to reduce friction and spend more time on foreplay. Not only is this safer, but it also makes you feel closer to each other. Talk to your spouse and say, let's take our time to make it perfect. If you're taking Viagra or another drug, give it time to work. This warning isn't a sign of weakness. It's a sign of wisdom. I've seen couples get back together after using this method, converting stressful situations into times of deep connection. And don't forget that if you think something is wrong, get help right away. Treatments like injections or shockwave therapy can fix harm that has already happened. Now let's talk about something more modern, but just as important. How too much porn can hurt your real-life relationships. Let's be honest. In this digital age, it's easy to get pornographic stuff right away. For many grown men, maybe because they're bereaved, divorced, or just feel alone, it can seem like a harmless way to get away from it all. But as a psychologist who has heard intimate confessions for decades, I can assure you that what starts out as a small diversion can slowly take away your real desires and relationships. Pornography overloads the brain with stimulation that is too intense, too quick, and often not real, changing the way neurons work. Over time, this causes desensitization. Your body gets used to this high level of sensation, which makes actual closeness, with all its flaws, less thrilling. Jean, a 67-year-old patient in a stable relationship, told me, I have desire, but nothing happens when I'm with my wife. After talking about this, we found out that his daily porn use had caused a disconnect. He found a passion he believed was lost by cutting back on what he ate and focusing on real-life connections. Studies from the University of Cambridge and other places demonstrate that too much porn can change the brain's reward centers in a way that is akin to an addiction. This raises the chance of psychogenic erectile dysfunction by 20 to 30%. Also, it can make men feel ashamed, alone, and that their self-esteem is gone. They wonder, am I still a man? I'm not judging, I'm just saying to be moderate. Don't do it more than once a week. Instead, try using natural stimulants like sensual recollections, your imagination, or talking openly with your spouse. Look into therapies like sexual mindfulness, which helps you focus on what you're feeling right now. This not only helped Jean get back to normal, but it also made his marriage stronger. They started exchanging fantasies, which brought them closer together. Keep in mind that actual desire doesn't go away. It changes with time. By restricting porn, you get it back in its most fulfilling form. Finally, let's talk about the base that holds everything up: living a healthy life instead of using drugs. After years of giving out prescriptions, I've learned one thing. Your daily activities have a much bigger effect on your sexual health than any medicine. A lot of patients come in seeking for a quick fix, but nothing works better than habits that remain. A strong erection depends on good blood flow, balanced hormones, and good mental health. What you eat, how you move, and how you rest all affect these things. Smoking hurts blood vessels, drinking too much alcohol lowers testosterone, and a diet low in nutrients clogs arteries. In reality, erectile dysfunction is often a symptom that something is wrong with the heart. Research from the Mayo Clinic shows that it happens 3 to 5 years before heart attacks in 50% of men. But what about the magic? Changes that are good happen quickly. Your circulation will get better in just a few weeks if you stop smoking. You may increase nitric oxide synthesis, which is important for erections, by walking for 30 minutes a day and eating foods like nuts, berries, and fish high in omega-3s. Lewis, 70, diabetic, and not very active, came in for erectile dysfunction, which is a great example. We didn't give him medicines right away. Instead, we talked about his lifestyle: more exercise, less sugar, and getting more sleep. Not only did his erections come back spontaneously after 6 months, but his diabetes also got better, and he shed 15 pounds feeling like a new man. The evidence backs it up. A meta-analysis in The Lancet showed that regular exercise lowers the risk of ED by 40%. Get 7 to 9 hours of sleep and meditate to deal with stress. Everything is connected. Your body isn't broken, it's just waiting for you to take care of it. And now, here's the extra tip I promised. Don't wear underwear when you sleep. It may seem small, but it can make a big difference. Your body heals itself as you sleep, and spontaneous overnight erections help to oxygenate tissues. Tight underwear can rub against your skin and cause irritation or scarring, which can lead to Peyronie's disease. Wear loose boxers or nothing at all to give your body time to heal. After making this easy change, I've heard from patients that they feel better in the morning and their function has improved. Early research in urology shows that it lowers the likelihood of persistent compression. You're not just keeping your sexual health by doing all of these things. Activity, hygiene, being careful with sex, limiting porn, living a healthy lifestyle, and this midnight hack. You're also getting back your whole dignity. I've helped guys regain this confidence throughout the years, not by trying to look younger, but by accepting their current wisdom. If you're feeling this way, remember that you're not alone and that it's never too late. Take a tiny step today, like going for a walk or cleaning up your hygiene. Thanks for being there with me during this time. Let's keep breaking the rules around men's health. You deserve to take care of yourself.